Hi guys, so today in our series of lectures on hepatobiliary system, after discussing numerous conditions related to liver, be it acute hepatitis, acute liver failure, metabolic liver diseases, alcoholic liver disease, and autoimmune hepatitis, now it's time to talk about chronic hepatitis. Chronic hepatitis progressing into cirrhosis and then development of portal hypertension, and over a period of time, there can be decompensated cirrhosis or acute on chronic liver failure. Okay, so let's understand a few things first. Suppose if a person is suffering from chronic hepatitis, take example of chronic hepatitis B. Chronic hepatitis means disease lasting for at least more than 6 months or more than 26 weeks. अगर इससे कम ड्यूरेशन है, you will have to classify it under acute hepatitis or subacute hepatitis. Okay, so chronicity is basically any liver disease of more than 6 months. Over a period of time, chronic hepatitis B can progress into cirrhosis. Okay, that is fibrosis of the liver. Then cirrhosis over a period of time can develop portal hypertension and then decompensated cirrhosis. Decompensated cirrhosis. Decompensated cirrhosis. कब कहेंगे हम लोग decompensated cirrhosis है? If patient of chronic liver disease develops ascites, develops variceal bleed, develops hepatic encephalopathy. Very important. Okay, and during this course of disease, patient can develop liver failure anytime, right? That is known as acute on chronic liver failure, right? And there will be appearance of jaundice along with ascites. So this is very simple concept, right? We have just studied the progression of chronic liver disease. Patient can recover also, okay? But recovery is in initial stages only, okay? So these are series of events for chronic liver disease. Let's first understand what are the various causes of chronic liver disease. First of all, we have alcoholic liver disease, evergreen substance and most common cause of chronic liver disease, okay? Then you have chronic viral hepatitis. We have already studied viral hepatitis. And among the hepatotropic viruses, hepatitis E and hepatitis E can cause only acute hepatitis, not chronic, be it acute hepatitis or acute liver failure. Hepatitis A alphabetically comes first. We have studied this, and this is most common in children. Hepatitis E alphabetically last among hepatotropic viruses, and this is most common form of acute hepatitis or cause of acute liver failure in adults. For acute liver diseases only. Whereas hepatitis C virus, D virus and even B virus can cause acute as well as chronic hepatitis. Hepatitis C virus. Here you have C, okay? So this have maximum chances of developing chronic hepatitis. But overall incidence of hepatitis B is far more as compared to hepatitis C. So in general, viral hepatitis due to hepatitis B is seen in more number, right? Then you have alcoholic and non-alcoholic steatohepatitis. We have already discussed non-alcoholic fatty liver disease, non-alcoholic fatty liver disease. Then you have cholestatic conditions like primary biliary cirrhosis and primary sclerosing cholangitis. Metabolic diseases in form of hemochromatosis. In hemochromatosis, there will be increased iron overload, whereas in Wilson's disease, there will be increased copper overload. We have studied. Then few genetic conditions, be it alpha-1 antitrypsin deficiency and cystic fibrosis. These are few common conditions which can lead to a chronic hepatitis progressing into chronic liver disease or decompensated cirrhosis or acute on chronic liver failure, okay? Now let's once again understand the progression of the disease. Take example of alcoholic liver disease, right? Let's start from chronic hepatitis, okay? Chronic hepatitis. Chronic hepatitis progressing into cirrhosis. And then cirrhosis over a period of time will cause pressure in portal veins to increase, that is portal hypertension, and then portal hypertension over period of time can lead to complications, be it ascites, be it variceal bleed, right? This is known as decompensated liver cirrhosis. Okay, very simple. And during this course of disease, patient can develop liver failure, that is known as acute or chronic liver failure, manifested by jaundice, ascites, etc. Okay, so these are the series of events. फिर से एक बार देख लेते हैं. You have chronic liver disease progressing into liver cirrhosis, progressing into portal hypertension, progressing into decompensated cirrhosis, okay, due to ascites. So ascites is first sign of decompensated cirrhosis. It can be also associated with hepatic encephalopathy. It can also be associated with variceal bleed in form of hematemesis and perrectal bleed. Okay. During this course of illness, patient can develop acute on chronic liver failure. Very simple. अब आगे चलते हैं. We have understood the basics. There are various clinical manifestations of chronic liver disease. Few can be directly related to liver, right? Few can be indirectly related to liver. For example, jaundice can be directly related to a liver disease, okay? For example, edema, ascites can also be directly related to liver disease due to decreased albumin. In a similar way, you have leukonychia, that is white nails due to decreased albumin, also known as terry nails, okay? But few clinical manifestations cannot be directly related to liver. For example, take gynecomastia in males and breast atrophy in females. Unfortunately, it can lead to gynecomastia in males, that is breast enlargement in males, whereas breast atrophy in females, along with testicular atrophy in males, along with loss of libido in males. Okay. So other clinical features are there, mainly due to vasodilation, and these are caput medusae, spider nevi, palmar erythema. Okay. और भी कुछ clinical manifestations हैं, हम लोग discuss करते हैं. Like you have palmar erythema, you have caput medusae, you have spider nevi. Okay. So there are multiple clinical features related to chronic liver disease. We will try to understand each one of them one by one. Let's again see few clinical manifestations. You have ascites, hepatomegaly. In case of chronic liver diseases, initially there might be hepatomegaly due to inflammation of liver. But over a period of time, liver cells will be replaced by fibrous tissue, and with fibrosis, liver can shrink in size. Okay, so hepatomegaly might be absent in later cases. Caput medusae, prominent veins around umbilicus, gynecomastia, icterus, palmar erythema, spider nevi. Here you have leukonychia. Leukonychia means white nails, also known as terry nails. Okay, this is due to decreased albumin. You have fetor hepaticus due to increased level of mercaptans. Okay, increased mercaptans bypass liver and reach lungs. Okay, from lungs they are excreted out, giving rise to peculiar smell that is known as fetor hepaticus. Okay, एक concept देखते हैं. हम लोगों ने कहा males में there are three main complications in form of gynecomastia, in form of testicular atrophy, atrophy of testis, and loss of libido. These manifestations can be explained with the fact that in males or in chronic liver disease, there is increased level of estrogen, right? If estrogen level increases in males, it can lead to these type of complications. Let's understand why the estrogen level increases, okay? This is androstenedione, and this is converted into estrogen compound, okay? This androstenedione is secreted by adrenal gland, normally secreted by adrenal gland, and it is weak androgen, okay? When liver is normal, liver picks up this androstenedione and destroys it, right? Or metabolizes it. So level of androstenedione is kept in check. Example, take this is your functional liver, and then you have kidneys. Here you have adrenal gland. Okay? Adrenal gland secretes androstenedione, and this is taken up by liver and destroyed. Okay? Remember in this way. But if your liver is not functional, liver cannot do uptake of this substance and metabolize. So in case of chronic liver disease, level of androstenedione increases, which is further converted into estrogen in peripheral tissues, particularly adipose tissues, with help of aromatase enzyme. Let's see. Suppose someone is suffering from chronic liver disease, and in this patient there is secretion of what? Androstenedione. This androstenedione might not be taken up by liver, so it is not getting destroyed in patients of chronic liver disease. So level of androstenedione can increase, and this androstenedione escapes in peripheral circulation and gets converted into estrogen, okay, with help of enzyme aromatase, right, mainly in adipose tissues. So this is aromatization of androstenedione and resulting in increased estrogen, right? This will bring lot of complications, particularly in male patients. Plus this is a strong vasodilator. So various other clinical manifestations in case of chronic liver disease can be associated with vasodilator effects of various compounds. One of them is estrogen, right? So you can also cause caput medusae. This can also cause spider nevi and Palmer erythema. Okay? So various manifestations can be related to vasodilator substances, and you can memorize it. It might not be always estrogen leading to these conditions, right? Caput medusae, spider nevi and Palmer erythema. Now it has become very easy to memorize all the clinical features of chronic liver disease. This is caput medusae. This is spider nevi. This is gynecomastia, right? Interesting case. लोग ऐसे लोगों के काफ़ी मजे लेते हैं. Gynecomastia in males, breast atrophy in females. Okay. एक बार इसको रिकैप करते हैं और कुछ फंडा लगाते हैं जिससे तुम लोगों को ज़्यादा टाइम तक ये याद रहे. Okay. Let's talk about clinical features of chronic liver disease. तो पहली चीज़ हम लोग इसको डिवाइड कर लेते हैं. Clinical features due to increased estrogen. Okay. एस्ट्रोजन क्यों इंक्रीज करेगा हम लोगों ने ऑलरेडी देख लिया है. अगर मैं मेल्स की बात करूं, इन पर्टिकुलर देर इज व्हाट, देर इज गायनेकोमास्टिया, that is breast enlargement in males. Then you have testicular atrophy. Third is loss of libido. Okay, very, very simple. But in case of females, this is not the case. In females, there is breast atrophy. Okay, रिवर्स हो रहा है यहाँ पे. इसके अलावा भी हम लोगों ने डिस्कस किया है, दिस एस्ट्रोजन हैज़ ऑल्सो विच इफेक्ट, वेसोडाइलेटरी एफर्ट, वेसोडाइलेटर. ओके, तो यहाँ पे कुछ और क्लिनिकल फीचर्स भले ही डायरेक्टली रिलेटेड ना हो, यू कैन रिमेंबर इन फॉर्म ऑफ caput medusae, and then you have spider nevi, and finally you have one more thing, Palmer erythema. कुछ क्लिनिकल फीचर्स और हैं, उनको हम लोग कैसे याद कर सकते हैं. यू हैव ड्यू टू डिक्रीज्ड एल्ब्यूमिन, राइट? यू कैन एक्सप्लेन एडिमा, इवन एसाइटिस, right? Even anasarca due to decreased level of albumin leading to decreased oncotic pressure. And B is terinae, that is white nails, that is leukonychia. So we are done with clinical features of chronic liver disease इसमें जानबूझ के आई डिड नॉट इंक्लूड पोर्टल हाइपरटेंशन, क्योंकि नेक्स्ट टॉपिक हम लोग पोर्टल हाइपरटेंशन पढ़ेंगे, उससे रिलेटेड क्लिनिकल फीचर्स भी क्रॉनिक लिवर डिसीज के पार्ट होंगे. लेट्स सी व्हाट इज पोर्टल हाइपरटेंशन, व्हाट इज पोर्टल वेन. राइट, पोर्टल वेन कुछ इस तरीके से होगी. राइट, दिस विल ब्रिंग all the blood from intestinal regions so that liver can pick up various metabolites and substances. So this is your portal vein, this is splenic vein, and this is superior mesenteric vein. This takes blood to liver sinusoids and then it is given to inferior vena cava and finally heart. Okay? तो अगर मैं कहूँ पोर्टल वेन के अंदर प्रेशर इंक्रीज हो जाए, दिस इज नोन एज पोर्टल हाइपरटेंशन. वेरी सिंपल थिंग. अब अगर मैं कहूँ पोर्टल वेन का प्रेशर, पोर्टल वेन प्रेशर नॉर्मल कितना होगा, लेस देन 10 mmHg. बट पोर्टल वेन प्रेशर इज मेजर्ड इनडायरेक्टली विथ हेल्प ऑफ hepatic venous pressure gradient HVPG, and this is normally less than 5 mmHg. Okay, and this reflects portal vein pressure indirectly. Okay, so if hepatic venous pressure gradient increases more than 5 mm, it means there is portal hypertension. Okay, or portal vein pressure itself increases more than 10 mm. Okay, so this is very important. Now, hepatic venous pressure gradient of 1 to 5 millimeter is normal. Okay, if it increases more than 5, it is portal hypertension. If it increases more than 10, then it is clinically significant portal hypertension.